Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and I've been in practice in the Scottsdale Paradise Valley area since 1992. Today I'm going to talk about a common question that patients have when they come in and see me, and that is, how do I know if I'm too young for a facelift? And the answer to that question involves a lot of things. The first thing is that people are generally scared of the word facelift. And they shouldn't be. I think when a facelift is done expertly and technically, with a lot of experience and aesthetic perspective, you should know that I've performed the surgery. But basically, in terms of when patients come in and feel that they may be too young, I think you have to understand that a lot goes into that equation about who needs a facelift. Some patients benefit from a mini facelift, some patients need a more comprehensive surgery. But the first thing is to see what someone's skin type is like, whether the skin elasticity is good, whether there's been a history of sun damage or smoking. Generally, those patients tend to age a bit younger, and there's usually also a family history of that. Also, those patients, at least in Arizona, that have sun exposure and are thin, tend to look older than patients that don't have that sun exposure and may have a fuller face or a little bit better, broader bone structure. So patients that come in, I see the best thing to do is to understand that a facelift addresses, if we're just talking about a facelift alone, not the eyes and the brow, but a facelift addresses everything below the eyes. It addresses the jowls, the cheek descent, and also the neck and the neck laxity. A mini facelift addresses just the cheek area. So a combination of many things can be performed at different ages. Some patients come in that are 40 or so, 35, and actually may need a cheek lift, a mini facelift. Oftentimes I'll do some laser resurfacing. I may do some eyelid procedures. Oftentimes I'll do fat transfer to make patients' faces look a bit more voluptuous and younger. Other patients come in that are 45 or 50 or even 40 that actually need a facelift. And why that is they have a lot of neck laxity, they have some banding of their neck from the muscle laxity, and have loss of the volume of the cheek area with beginning of jowls. And a more elegant result is achieved when I perform a formal facelift. That is also performed in conjunction oftentimes with fat transfer, eyelid surgery, laser resurfacing. So the best thing to understand is there really is no format of when someone is the right age for a facelift. It really depends upon many things, and the best thing to do is to come in, sit and talk with me and get an opinion. We'll look in the mirror and I'll show you what I can do. Thank you.